How do you counsel patients on coping with the emotional side of AML? What advice and resources are available?
So the advice that I tell people is that this is a journey. This is not a one-day process. And so my advice is we really need to take this on a day-by-day basis. Don't think about what's going to happen 3 months from now. Let's work on going step by step, day by day. I think that's one of the easier things for me to say and harder things for a patient to do. But I think by, again, giving that roadmap, it makes it easier and it sort of empowers them to understand what their next steps are going to be in this entire process. And sometimes if we need to, we can have psychiatry involved. Sometimes we can have social work involved. Some patients even ask for medications in order to help with that, and we have those medications. But that's why it's so important to have that communication so that we can help with things that are bothering the patient that may not be just related to the disease itself.
Why is the role of a care partner, a friend, or family member so important? How can they help?
I think there's something to be said about having a familiar person go through a difficult process with the patient. Um, you know, I spend a tremendous amount of time with my patients, but I don't have a history that dates back many years. Um, Although I do end up having that at some point. In the beginning, that's not what we have. And
Right.
I think it's important while I'm getting to know the patient to have somebody who does know the patient, that knows sort of the patient's, their way of looking at things, their ins and outs of how they see the world and how they're going to react to different aspects of their care. Having somebody like that around is extraordinarily important from a patient comfort standpoint, but also from a caregiver, from a practitioner standpoint. It's good to have another person there. But the other reason I think that gets a little bit underrated is in those initial assessments, in those first days where we're sitting down and talking to the patient and say, hey, here's what's happening, here's what's going on. It's really hard to sit down and listen and get a full understanding in one shot. And we don't try to do it in one shot. We try to be available, but having a second set of ears or a third set of ears or a fourth set of ears is very important because an hour later, the patient may say, wait a minute, what did that mean? Why didn't we ask that? And having somebody else there at that moment to say, oh, we did ask that. Here's what we talked about. This is what we said. Having that second set of ears in a time where it's overwhelming is really very helpful to the patient.